As a naturopath that specializes in vaginal health, I get asked a lot of questions about boric acid and what are my thoughts on it. So let's talk a bit more about it. Boric acid can be a real game changer if you're someone that experiences recurrent infections. They can really help with symptoms like abnormal discharge, odor, and itching because they have antibacterial, antifungal, and biofilm disrupting properties. And those properties make it really helpful for someone experiencing recurrent thrush or recurrent BV. So when should you use it and how often? For my clients experiencing recurrent BV, I usually recommend it to be used nightly for 3 to 4 nights consecutively after your period ends. You repeat that pattern each menstrual cycle, and the purpose of it is to re-acidify post-menstruation, and re-acidifying helps keep away BV associated bacteria like Gardnerella, which really thrive in that higher pH and really thrive in an iron-rich environment. It can also be used post-intercourse as well as a preventative if you're really prone to infections triggered by sex specifically. For my patients experiencing recurrent thrush, I recommend to use the insertions around the risk time of your cycle. So that is usually around ovulation when estrogen peaks and also throughout the luteal phase, so in the lead up to when your period starts. Another quick tip I recommend to my patients using boric acid is if you have vulval irritation or inflammation, it can be helpful to use a barrier cream on the external vulval area before inserting the boric acid. That way, when it lets down, you can prevent any irritation. And you also want to be sure to insert the boric acid as high as possible and as high as is comfortable into the vagina so that it has time to let down, and that also helps with reducing irritation.